So, as we said earlier, that there are only three process or lifestyle changes that you can use to treat diabetes, and one is exercise, number two is fasting, then number three is adding too much fibers into your food. It is only some of the effects or the effects that diabetes brings into your life that you can use medication to treat it. And one is glaucoma. You know, glaucoma is one causes of glucose inflammations or high glucose level in your body. It's also combined with pressure to create strokes. Number three is kidney problems. They are all caused by high level of glucose in your body, and that is which one or one is also diabetes. So these are some of the causes or the effects that diabetes can bring into your life. But the diabetes or high glucose level inside your body, you can never treat it with medication. It is only your lifestyle sick life. It's a lifestyle sickness. So it is a lifestyle adaptation or lifestyle changes that you can only use to treat this kind of sickness, which is high glucose level in your body. And one of it, as I was saying, is exercise. And as I have said earlier, that here is a health retreat. So whatever problem that is bothering you concerning your health, you can contact me. Either WhatsApp me, email me, or contact me on 024636867 or 059 3669588. 059 3669588. On email, it is ixglory at gmail.com. ixglory at gmail.com. On all social media, it is ixglory. ixglory on all social media. So today we are going to see the effect of exercise on diabetes or high glucose level in our body. You know, whenever you are at rest, your body used to work, and that is when a lot of energy is being made inside you. When you are at rest, your body, your that is when your lungs takes time to inhale too much oxygen, which is being supplied to the cardiovascular system, then it then enters into your blood cells. And as I was saying earlier, that in the blood cells, which is the CBD of your body, which is the CBD of your body. So this is one blood cell here, and you know it contains food nutrients, oxygen, and then water. That is what is in this blood cell: food, nutrients, oxygen, and then water. So the food, nutrient, oxygen, and then water. One of it is the oxygen that is entering into the blood cell. So oxygen here. So oxygen is oxygen entering into the cells, passes through the lungs, through inhaling it through your nose, then it gets into the cardiovascular, which is your heart. Then your heart will pump it into the blood cells. And when it gets into your blood cells, because your body is relaxing through the pyruvate, that is oxygen combining with oxygen, then combined with glycolysis. So glycolysis or glycolysis glycolysis to produce pyruvate. So here is the pyruvate, and that pyruvate, that is when your body is at rest. You are not doing anything. So these two process then combine through 8 steps pathway. So through 8 steps pathway to produce 36 units of energy. That is 36 units of energy. 36 units of energy. That is when you are at rest, when you are not doing anything. This is what happens. So through that 36 units of energy, that is through the 8 steps pathway. In every steps that the the oxygen and the glycolysis, or the oxygen plus the glucose passes, it produces different kinds of energy. Some will produce 2, some will produce 6, some will produce 8, but at the end, it will produce 36 units of energy. That is when your body is at rest. So this is how the energy is being produced inside your blood cell. But immediately when you start exercising, so this blood cells, the energy that is being produced here is through an aerobic process. So aerobic process, and this process means that oxygen is inclusive, or the process is being produced by the addition of oxygen. That is aerobic process. And because it is produced through aerobic process, the amount of energy that is being given or produced is very high. That is when your body is at rest, and this process is then stored in your muscle cells. And your muscle cells can be stored here, every part of your body. You understand? So this is when you are at rest. But the moment you start exercising, the glucose or the energy that is being stored in your muscle cells then starts to do the immediate immediate starting of the exercise. That is where the energy will come from. The energy that is being deposited in your muscle will then start the exercise. That is a sequence to about 3 4 seconds. That is when you have started exercising. The energy that is stored in your muscles will then start exercising. So it will start plunging up, then give you an energy to work in 4 to 3 minutes. At that time, because your body has stored an enough energy that it thinks that it can use for normal activities, it does not initially need to produce energy again, because there has been an energy that is produced inside your cells. So it will not need an immediate energy production to be produced. So it is this muscles energy. One is muscle energy. Muscle energy, which is ATP. So that is 30 seconds, or the first seconds to about 5 seconds. So within the 1 second to 5 seconds, that is where your energy will be produced inside your body for you to use it to exercise. But and this energy, because it is stored for normal life activity like talking, working, it is being stored, but not as plenty as you can use to work or to do high intensive exercise. Now, there is one thing that I have to tell you, is that all this that I'm coming to show you right now will depends on the time that you use to exercise, the intensity that you, or the kind of exercise that you go, and your body strength or your physical strength will determine the amount of glucose that will be liberated outside your body. So the time that you use to work, the intensity or the kind of exercise that you will do, and also your physical condition will determine the amount of glucose that will be liberated or be reduced outside or inside your body. So within the first seconds to 5 seconds, the glucose that is being stored in your muscle cells, or the energy that is being stored in your muscle cells, will then be used in the exercise. After 5 seconds, when the muscle exercise, or when the muscle glucose, or that is when the muscle's energy is being finished, there is in the body, through the energy production, there will be a process where the glucose is being producing the pyruvate. But because there has been a storage of energy in the muscles, it is then waiting small small in the production. So that oxygen, which is combined with the glycolysis to produce the pyruvate, during the 5 seconds of energy, This process has to automatically speed up to produce an enough energy, because your body needs a lot of energy for you to convert in the exercise that you are doing. So the body needs an immediate energy to be converted so that you can get the strength for the exercise. So the immediate energy that the body will produce, that is when the muscles energy or the muscles energy is being finished or depleted. We call it number two exercise, or number two energy. We call it the creatine or the creatine ATP, creatine energy. And this creatine energy here is a glucose combined with oxygen automatically. But it is not ATP instant. It is ADP, which is ADP, as adenosine diphosphate. It is not ATP or adenosine triphosphate instant. It is adenosine diphosphate. So this adenosine diphosphate will then be converted into ATP to produce the energy that you will use in the exercise that you are doing. And this will happen in the 5 seconds to 10 seconds. In the 5 seconds to 10 seconds, this is when the creatine energy is being made. So automatically the oxygen and then the glucose which is inside your body will then convert through the process to produce adenosine diphosphate. Then the adenosine diphosphate will automatically be converted into adenosine triphosphate to produce the unit of energy that you use within that 5 to 10 seconds during an intensive or the intensity exercise. And as I was saying that this process can either move faster or slower depending on the kind of energy, the time that you are using to exercise, and your body condition. This is how the process happens. So in the next three processes, that is when this creating energy has finished. Your body automatically, because you are on high intensive energy or you are exercising, or the exercise that you are doing, you haven't stopped instantly. Your body still needs to produce an energy for you to work. So automatically, your body needs to generate energy from wherever it can get it from. And the first place to think of is the glycogen stores. So the glycogen stores then comes in. So the glycogen stores then comes in. The glycogen stores or the glucose will then comes in. And this process is anaerobic. This process is anaerobic because your body is in an intensive or intensity energy production, and it needs energy quickly for your body to produce or to work. It then goes for the glycogen stores to produce energy instantly for you to work. And this process, because there is no oxygen, the amount of energy that is being produced is very low. So the body will then work on the glycogen stores and then depurate all the glycogen that is stored in the glycogen stores. And it is this moment that is when, if your stores or the blood cells, the cell store is being closed, it automatically opened for the glucose outside the cells to automatically drop into your blood cells. I said it is at this moment, that is when, if your blood cells is closed and the glucose is outside your blood cells, glucose is outside your blood cells, it is this moment that the cells automatically opened. That is minute 10, from the 10th 15 minutes or 15 seconds, from the 10 seconds to 15 seconds. So, and I said it depends on the intensity or the kind of exercise that you are doing. If you are doing an intensity energy or intensity exercise, this is how it happens. So in 10 to 15 seconds, your blood cells or the energy production, because it has been depleted, the muscle energy has been depleted and the creatine energy has also been depleted. The blood or the energy production straightly goes to the glycogen stores to produce energy from, and this energy production is an anaerobic. And this anaerobic, because there is there is no oxygen in this production, the energy that is produced here is very low. So because the energy that is produced here is very low, and the body also needs a lot of energy, it then cranks it higher and more to produce the energy that you use. So when your glycogen stores, and remember, depending on the glycogen stores, which I said that a person with 1 kilo, 1 kg has a glycogen stores of 4.35 grams, 35 grams. So depending on your body weight and the amount of glycogen that is being stored in your glycogen stores, if your glycogen stores is finished, or if the glycogen stores is empty, automatically, and there is glucose outside the cells, automatically the glucose will then be planned, or the cells, the gate of the cells will be then open for the insulin to carry the glucose inside the cells for the body to be used as an energy. And because, as I was saying, because here there is no oxygen here, and the energy that is being produced here is very low, it then plugs in a higher quantity to produce an energy that the body needs. So this is the area when glucose, or when glucose that is stored or that is packaged or put outside the cells then get into the blood cells for you to reduce the amount of glucose that is left in your body. That is why we said exercise reduces glucose level in the blood. And after the glycogen stores and the glucose that is left outside the cells, that is when you are on too much carbohydrate diet food, and there is a lot of glucose outside your cells. After it is finished, your body then needs to get into your cells to still produce an energy for your body. So this process will happen either either so the four process goes for fatty acid, fatty acid, or the amino acid, that is the protein, or the amino acid. And this process, as I was saying, it comes in a Krebs cycle. So it might be that this process, since the fatty acid comes with a Krebs cycle,